So in this video I'm going to show you how we draw or reconstitute powders into solutions when they're cytotoxic. This drug's called asparagines, and we don't use a closed system when we do this, so this is exactly how you would be doing it out in practice if you were using this item. So first of all, we need to get our water. I've just got a little spike in this just because we use it multiple times, but a needle will suffice. And you can see I'm using a Lure-Lock syringe, and that's important that you use these at all times, because basically it's just an extra safety feature. When we screw that needle in place, it's not going to pull off. So when you're injecting the animal, if they move, that bit's not going to come detached, so it's just a little extra safety feature. So you want to get a swab with some alcohol on it. Just like that, handy. All our soft waste goes into these little bags, and when the bag's full, we can seal that over, and basically it just goes out as cytotoxic waste. Any of the sharps waste will go into this cytotoxic sharp bucket here. You know cytotoxic stuff because it's always yellow with the purple. So we've drawn out our water, and sometimes these vials are under pressure, so when you spike the vial, sometimes the fluid will get sucked in. These ones aren't, so what we want to do is basically inject the liquid down the side of the bottle, just slowly, so it trickles down the side. And we can kind of calibrate the pressure just by letting the plunger go up, because if you think you're injecting the water in, so the air has to go somewhere, to replace the water that you're putting in. So I tend to leave it like that. I'll leave the needle and syringe in place, because if I pull that out, basically there is a risk that little aerosols will come out with it. So I leave it all in place, I'll wrap my swab around, and then I'll just gently mix the solution until I see that all the powder's dissolved. That's fine. The next thing I want to do is basically to ease my drawing out the liquid, I'll put the air back into the pot. So this is just air that's been expelled when I've put the liquid in. So I'll put the air back in, and then we want to tip it upside down, wrapping our swab in place, and start sucking out the liquid. And this method would be the way you would drop any liquid for injection, regardless of whether you're having to make it up from a powder or if it comes already in a solution form. So you always draw out your volume, and you always want to re-invert your vial and wrap your swab around, and then pull your needle out. And basically, if any aerosol droplets do come out as you pull your needle out, they're trapped in that swab. Ideally, you don't want to recap your needle and syringe, but I'm not going to inject the dog straight away. So when you do recap, always slide it in on the tray. Don't put your fingers, try and do it with your hands, just scoop it up on the tray and then push that on. This will be contaminated, so that will go into the soft waste. And this is classed as sharps, so we'll go into the sharps bucket.